Bismillahirrahmanirrahim. Today we will talk about tablet progyluton, a commonly prescribed drug in gynecology. And we will start from the indications of tablet progyluton. Progyluton is used for various purposes in gynae, like first of all, it is used for contraception purposes. Secondly, it is used to treat the menstrual irregularities and dysmenorrhea and menorrhagia. Thirdly, it is used to treat the premenstrual syndrome. Fourthly, for primary and secondary amenorrhea, including the premature ovarian failure, the tablet progyluton is very helpful. Also, it is used to treat the deficiency symptoms after oophorectomy or radiological castration for non-carcinomatous diseases. And also, it is used for menopause associated symptoms such as the vulvar or vaginal atrophy to prevent the vasomotor symptoms and osteoporosis. Let us talk about the contraindications of tablet progyluton. The tablet progyluton is contraindicated in a condition like, first of all, hypersensitivity to active substances or to any of the excipients. Secondly, in the present or suspected breast cancer or suspected sex hormone dependent premalignant or malignant diseases or untreated endometrial hyperplasia, this tablet is contraindicated. Thirdly, it is contraindicated in unclarified vaginal bleeding. Another contraindication is present or past benign or malignant hepatic tumor or serious liver conditions, including the past medical history if the liver function values have not returned to the normal. Also, in conditions like present or past venous thromboembolism, this tablet is contraindicated. For example, in deep venous thrombosis, pulmonary embolism, acute or recent arterial thrombotic events, for example, the cerebral or myocardial infarctions, presence of the risk factors for arterial or venous thromboembolic events, for example, antithrombin protein S or C deficiency. Also, it is contraindicated in severe hypertriglyceridemia. It is contraindicated in porphyria and in pregnancy and lactation. Now, what does tablet progyluton contain and in what dose? This tablet comes in a pack of 21 tablets with first 11 white tablets and next 10 red tablets. The white tablets contain estradiol valerate 2 mg each tablet, and the red tablet progyluton contains estradiol 2 mg and norgastrel of 0.5 mg. Now, how to use the tablet progyluton? It is given in the sequential regime and in the continuous regime form. So, let us talk about the sequential regime. Progyluton is a cyclic HRT product. One tablet is to be taken orally once a day for 21 days in the sequential regime. The white tablet should be taken from day 1 to 11, followed by the brown or red tablets from day 12 to 21. And that is followed by 7 days tablet-free interval. Therefore, each new pack is started after 28 days. Let us talk about the continuous regime. In certain cases when no menstruation is required, the progyluton tablets can be taken as continuous regime as well by taking it continuously starting from the first tablet in the pack without 7 days break. Let us talk about the mechanism of action of tablet progyluton. Progyluton is two-step HRT preparation containing two types of hormone, estradiol and norgastrel. Estradiol. In the tablet progyluton, estradiol is provided up to 11th day. After oral administration, the active substance estradiol valerate is rapidly released and it works at its receptor on the uterus by keeping it in the follicular phase. Next comes the role of norgastrel. In the uterus, the secretory transformation of endometrium proliferated under estrogen influence is induced by its effect. When the progesterone concentration falls, the endometrium previously proliferated by the estrogen is then shed. The additional administration of progesterone on day 12 to 21 during each cycle, together with a continuous estrogen therapy, largely prevents the overstimulation of endometrium, which would otherwise happen with estrogen monotherapy. Let us talk about this special consideration regarding the tablet progyluton. First of all, let us talk about a case of peri and postmenopausal symptoms. For the initiation and continuation of treatment of peri and postmenopausal symptoms, the lowest effective dose of the shortest duration is used. Second consideration is regarding menstruation. For women still having periods, the first tablet should be taken on the fifth day of their menstrual period. If the menstruation has stopped or is infrequent or sporadic, then the first tablet can be taken at any time. Third consideration is about if the patient is being transferred from continuous HRT product. The patient may start progyluton on any convenient day. For those transferring from a cyclic or sequential product, progyluton should be started following the completion of previous regimen. And next consideration is if the tablet is missed. If the tablet is missed, it should be taken as soon as possible unless it is more than 12 hours late. In this case, the missed tablet should be left in the pack and the next tablet taken at the right time. Missing a dose may result in breakthrough bleeding or spotting. Last is a case of hysterectomized women. Unless there is a previous diagnosis of endometriosis, it is not recommended that progestogen containing HRT be given to hysterectomized women. And last one, the side effects of tablet progyluton. The potential negative effects of each component that makes up the progyluton tablet are listed as below. First of all, the headache. Patient may complain of hair loss. Thirdly, the problem of itching may be there. And patient may complain of vaginal bleeding, spotting, or vaginal infections like vaginitis. Patient may complain of anxiety, increased weight, rashes, and yellowing color of the eyes or skin, abdominal cramps, tiredness or dizziness, mood changes or depression, nausea, and vomiting. So that was all about tablet progyluton. I would like to complete my presentation with this quote. Keep your face always toward the sun and the shadow will fall behind you. Thank you so much. Wish you all the best. Allah Hafiz.